In this video, I will be going over a little bit more fine-tuning details about using the Epiq as far as pulling up the patient's name and selecting the correct transducer for the study, and a little bit fine-tuning for color imaging and duplex Doppler. When trying to pull up the patient's name to initiate a study, you will select the tab Work List and then come over with the mouse and hit Update Work List, and you will pull up which patient you want and start their study. And if it is an abdomen on a regular sized adult, you'll most likely pick the 5 curved. If they are a thin adult or a child, I believe the 9 curved is the most appropriate transducer. In this particular setting, we have the 5-1 pulled up, and you have further options here. This is a general setting, and then using this knob, remember that on this touch screen here, that is in reference to this knob. So we can pick high resolution setting, the general, or the penetration setting for the heavier patients, or the deeper anatomy. If we were doing a venous study, we would want to use the 12-3. This would be a venous of both the legs and the arms. It's an all-around vascular probe that will suit your purposes in any vascular study of the extremities and of the neck. To select this probe, you come to the touch screen and you select the 12-3. And then you can select from any of these presets. Let's go to venous. And then the transducer comes up ready to scan. You can turn color on with this knob here. And then a number of functions come up on the touch screen, and the color box is here. If the blood vessel is going in this direction, then this angle of box is correct. But if the blood vessel was coming in this direction, then you would want to change your color box to here. It should be at the same angle that the vessel is going in. If you wanted to change the scale, which you can see the scale up here, if you wanted to change the scale, again, you come down to the touch screen and see that the scale is highlighted here, so this knob controls it. And you simply turn it to change the scale lower or higher. Once that is set, you can further tweak it by turning the color button that you press to turn the color on. You simply turn it for color gain or to decrease the color gain. And to get the color off the screen and return to grayscale, you select 2D. If the object that you are imaging is up here towards the transducer, you want to bring your focus up If the object is deep, you bring your focus deep. You can also increase your depth using this button here by just turning it. And this is the focus knob to bring the focus up or down. Then you freeze your image, annotate your image, using the preset annotations or the keyboard tab. You can type in whatever you want or use the keyboard underneath. Remembering to initiate the keyboard, you hit the space bar first and then type as you wish. When you are imaging and you want to turn the far field brighter, you can use the TGCs. Move them a little brighter, or if you want to make the far field darker, bring them in. If you want the near field to be brighter, turn the TGCs that way, or back for it to be darker. If you want your overall picture to be brighter, then you simply turn this knob, the 2D gain, or back if you want your image to be darker. If you want a velocity and a vessel, to clearly define that vessel, you would want to have the color on, and then select the pulse wave to get your sample box in. And you would want to angle correct. If you want a velocity, you need a good angle. If the vessel is going at this angle, then that is correct. If the vessel is more sharply angled, then you want to change your angle so that you can communicate to the machine at what angle the tracing is being sampled at. And that is how it puts it into the Doppler equation to get a more accurate velocity. Then to get your waveform, you hit the update button, and your scale is here. You can bring the baseline down. This is the button. This is indicating that it's baseline, and this is the button to turn. This is the scale your Doppler is set at. This is the scale that your color is set at. If this is a high flow vessel, you probably want to increase your scale, and that is right here. You can see the screen says scale, so that is indicating this is what this button's function is at this point in time. Then at the end of your study, when you are done, you want to hit the report tab here, and it will say acquire report if you had been scanning a study, and you would hit this button, and then the report would go into the study, and then you close that screen, and then to send it across into the system, you hit end exam. The 12.5 is used for superficial structures like the thyroid, testicle, or breast imaging. It can also do vascular studies on thin patients if you are unable to locate this transducer. And we covered the 5 curve is for your average to heavy adult, and the 9 curve is for the thin patient or pediatric. Some more transducers that you can select from. This is the S5. It can be used on the abdomen in a very large patient. You lose a lot of detail, but you penetrate much better. We also use this for transcranial Doppler studies. This is the L15. We often call it the hockey stick, and it images intraoperatively or pediatric patients' lumps and bumps. And the curved 8 is a tiny footprint on a curved transducer. We use this for neonatal heads. You can also use this to see the brachiocephalic vein when you're angling down in the crook of the neck.